Hey, welcome to the show, Miss Emily Blum. How are you today?
I'm good. How are you doing, Brett?
I'm doing wonderful. Tell us a little bit about your medical background and where you started and how you ended up in the South where you're at today.
So it's actually a funny journey, and the story of my life and the story of the people that I try to inspire or embrace the pivot in life. So starting from just being an elementary school student, I did an enrichment class and we went to the Cold Spring Harbor laboratories in New York, and I became fascinated with emerging infectious diseases. So I went to medical school planning on doing emerging infectious diseases. Again, that was the choice between Boston University for me, and they were opening up a level 4 lab and for this biohazard level 4 lab, and Emory, so I could work with the CDC. And decided, like I said, I didn't want to live in the South. So I went to Boston. And when I was there, I had everything set up perfectly to do infectious disease work and do an MPH when I graduated. And I did my first surgical rotation. And I said, crap, I'm a surgeon.
Yeah.
And so I embraced that pivot and pursued a career in urology. And I always liked the finite work and the finite surgery rather than the big, massive whack surgeries. And had an opportunity early in my career, which I was very fortunate about, to have exposure to pediatric urology. And just because some of the other residents had gone on vacation. And I did that, and everything was done with loops and really fine work. And I loved connecting with the kids. I was a patient myself as a child. And the ability to give back, be able to do that life-changing work for some of these kids and connect with both the families and the children, I saw my calling in life there. And so I pursued a career in pediatric urology. Never considered in my life being a surgeon, but I knew that that was where my flow state was. I knew that being in the OR was a happy spot for me, and I would be able to run with it. So when I do mentoring for medical students, when I talk to companies, you have to figure out what your sweet spot is. We live such a life that is well prescribed, right? We sit down when we're kids and we're saying, I'm going to go to this college. Really wish I could get into this graduate program. I'm going to go to this medical school. I'm going to do this with my career. And it rarely ends up as we have it mapped out. And if you try to stick to that map, you're setting yourself up for disappointment rather than taking any opportunity that presents itself, even if it's not where you thought your life would go, right? Even if it's not where you thought your career would go, even if it's not what your plan for your business is. You take every opportunity and you look at it with an open mind and say, okay, you know what? Let's be honest about this. I might be more successful. I'm happier doing this. I might make more money doing this. It's not what I intended. And it's going to take a little more effort, maybe. And that's the thing. People are afraid of the effort that sometimes you end up having to put in if you do make that pivot, because it feels like you're taking a step back. But the future success and the future happiness and the future financial gain from capitalizing on that could be astronomical. Looking at burnout in physicians, which is huge right now, and it's been huge for 10 years. So it's a problem that we haven't solved. And why haven't we solved it? Well, physicians nowadays don't feel any ownership in the care of patients. It's dictated to them by insurance companies, the hospitals that employ them, their physician contracts, whatever it might be. And so I've made it a mission of mine to try to educate the masses on what can you do to take ownership back. What can even a nurse do to take ownership back so it becomes more of a team sport and more of less of a hierarchy, right? So both from the hospital standpoint and from the physician standpoint, looking and being observant of all of the potential problems out there that you can actually solve, right? Not just be a player on the bench and running with the punches that hit you, but keep your eyes open. And what are there opportunities out there? Sometimes it's just a culture change. Sometimes you're not going to make any money by doing it, but teaching people and educating people on that thought process of how do you identify those problems? How do you decide if that's a problem that's worth pursuing? And then if it is a medical device, if it is a digital health technology, who do I go to talk to so that I can really decipher whether or not this is a good business opportunity to pursue? What does that look like from my standpoint if I'm an employed physician, if I'm not a solo practitioner, which is rare these days, to invest my own money? You know, does the IP get owned by my employer? All of these things. So putting it out there in the universe to educate people as to how they can impact more change. It's a very well scripted process at the beginning, in terms of you're going to make lots of, like I said, pivots in the end. But they're what we call at 𝗘𝗀𝗃 the phase 0 process. Everyone, when they come across a problem that they identify, you need to figure out, is it your problem or is it a global problem, right? Is there an actual market? So you start off doing just a clinical needs assessment. Every physician out there can do their own clinical needs assessment, right? So it's looking at the literature. It's going back and saying, okay, what is the root cause of the problem? What literature is out there that addresses that problem? And what solutions have been tried? And the solutions don't have to be medical devices. They can be anything. Looking at all that and documenting it, writing it down, just like you would write it down an intro and a discussion for your papers that you're trying to publish. You're doing the same exact thing when you're putting together a clinical needs assessment. And then you're talking to people too. You're not just calling up your friends that are in your same hospital system, but you're trying to expand your network, because maybe it's just the people that you trained with that have this problem. Maybe they don't know a different way to address it. So really talking to people, doing what we call voice of the customer research. And then sometimes most physicians need some help with that market assessment piece, but the next step, and I say steps, but these are kind of circular. They're all kind of going on in parallel to each other. You're going to look at your market assessment. Who are the competitors out there that are also addressing this problem? What giants are you facing? What is the growth potential if you really want to start investing in this idea and launch a company? What is the growth potential of the company? You know, what is a realistic market share that you're going to get? Is this a problem that I'm going to release a product out there and it's going to solve the problem, and so there's no growth potential? Well, you might have a hard time selling it that way. You can launch your own startup. I don't encourage physicians to take their startups from start to finish on their own. I think physicians are physicians for a reason. Start your company, find the right partner, find the right CEO, someone with experience. Unless you truly want to exit medicine, you can't do both at the same time. There's a rare exception to the person that can do both at the same time. So if that's not you, if you're not the person that wants to run with it, if you don't have this great idea that you want to do a startup, at least start educating yourself as to the process of, okay, what makes a good product? What are the things I need to look at? And then find yourself an angel investing group to invest in. Find yourself a venture capital group to invest in that is looking specifically for physician investors. Physician investors are low risk investors. They're willing to take those risks. They're willing to put down $50,000, $100,000. And so there are a bunch of them around the country that are always looking, and it's fun. And that passive income is the golden goose of everyone out there, right? Everyone wants to sit on the beach drinking a Mai Tai and knowing that their real estate investments or their venture capital endeavors are making money for them.
Tell us a little bit about your experience in real estate.
In real estate?
Yeah.
I flirted with the idea of real estate, but my experience with real estate is limited, shy of the fact that I've rented space out to people here and there. I've always had 2 and 3 bedroom houses. I've always been interested in it, but it's always been something that's intimidated me because I haven't had the time, quote unquote, to educate myself.
Yes.
But everyone that I know in medicine, if they haven't launched a company on their own, the happiest people that I know in medicine have invested time and effort and money into real estate investment.
Yeah.
So it's definitely something that is on my radar, but not something that I've endeavored into.
Like rock music? Like rock music?
Like rock music, exactly. But now I'm at the point in my career where I'm like, okay, you know what? Maybe I'll buy another house, live in that other house, rent mine, because I know I could rent it a lot. And I've looked into the commercial real estate market as well, because again, there's no better way to make your money work for you, I think, than in real estate.